Night splints sound simple, but do they actually help heal pain? If you've been dealing with plantar fasciitis, chances are someone has told you to try a night splint. Maybe your doctor recommended one. Maybe you saw them online. Maybe a friend swore they were a game changer. But here's what I hear in my Houston podiatry practice every day. Dr. Schneider, I tried the night splint for 2 nights and I couldn't sleep, so I gave up. Or I wore it for months and it didn't help at all. My name is Dr. Andrew Schneider. I'm a podiatrist with over 25 years of experience treating plantar fasciitis. And I'm going to give you the honest truth about night splints, when they work, when they don't, and most importantly, what should you do instead? Because here's the thing. Night splints can be helpful, but they're not magic. And if you're relying on them as your only treatment, you might be setting yourself up for disappointment. In this video, I'm going to tell you exactly what the research shows, why so many people quit using them, and how night splints fit into the smart treatment plan that actually works. But before we get started, if you're dealing with persistent heel pain, don't wait for it to get worse. Schedule an evaluation so we can figure out what's causing your pain and get you to the right treatment. The link to schedule an appointment is in the description below. And I've written an entire book about plantar fasciitis and heel pain that goes into much more detail about your treatment options. You can get it at www.heelpainbook.com. And if this information helps you, please hit the like button, subscribe to the channel, and share this video. It helps other people find the answers they're looking for. Let me start with a quick refresher on really what's happening with plantar fasciitis, because understanding this is crucial to understanding whether night splints will help you. Think of your plantar fascia like a thick rubber band that runs along the bottom of your foot from your heel to your toes. When everything's working normally, this rubber band supports your arch and helps you walk. But with plantar fasciitis, this tissue gets tiny tears in it, like when you stretch a rubber band too far and it starts to fray. It's not just swollen, it's actually damaged. It's micro-tearing and degeneration of the plantar fascia, not just inflammation. So here's why morning pain is so brutal. When you sleep, that damaged tissue tries to heal and tightens up. It's just how a cut on your skin forms a scab. The fascia tightens overnight, but when you take those first steps in the morning, you're stretching that tight healing tissue and essentially re-tearing it. First steps, re-tear healing tissue. That's why it feels like you're stepping on broken glass. So what is a night splint exactly? Picture a boot or a brace that holds your foot in a stretched position while you sleep. The basic concept is that it holds the ankle and foot in a stretched position overnight. Instead of letting your foot relax and point downward like it naturally wants to, the night splint keeps your toes pulled up towards your shin. It keeps the plantar fascia and the Achilles from tightening. There are different types of night splints. Some look like a boot that goes over the back of your leg. We call these boot style or posterior splints. Others have a shell that sits on the front of your shin. These are dorsal or front shell splints. And some are more like thick socks with straps. These are sock-based or strap design. The basic idea is the same. Keep your foot stretched up so that the plantar fascia doesn't tighten up overnight. Now here's how night splints are supposed to work. The theory behind them is simple. Think about it this way. If you keep that rubber band gently stretched all night, it can't tighten up and form that painful morning stiffness. It prevents overnight shortening, so when you get out of bed, you're not re-tearing healing tissue with those first steps. It reduces morning first step pain. What they do well is address early morning symptoms and improve short-term stiffness. For some people, this actually works pretty well. They wake up with much less pain and can start their day without that awful first step agony. But here's where we need to separate theory from reality. So do night splints actually work? Let me give you the evidence-based answer. When they tend to help, if your plantar fasciitis is relatively new, we're talking early or mild plantar fasciitis. If your main problem is severe morning pain, but you feel better once you start moving around, patients with severe morning pain. And if you have tight calf muscles or Achilles involvement, because tight calves pull on the plantar fascia and make the problem worse, tight calf or Achilles involvement. But when they tend to fail, if you've been dealing with heel pain for months or years, long-standing plantar fasciitis, if you have significant tissue degeneration, if the damage is usually too advanced for a night splint to make a difference, or if you have poor compliance due to discomfort, And this is the big one, people simply can't sleep with them on. And that brings us to the elephant in the room, why so many patients stop using night splints. The reality is they're bulky. Imagine trying to sleep with a boot on your foot. They disrupt sleep. They're hot or restrictive. Some people feel like their foot's trapped in a cage. Your partner might complain because you're kicking them with this hard plastic device. You might not be able to sleep on your side the way you normally do. And here's the thing, night splints work only if worn consistently. If you can't sleep with them on, they're useless. It's a classic case of works in theory, not in real life for many patients. Let me tell you about some common mistakes I see patients make with night splints. First mistake, wearing them incorrectly. Some people wear them too loose thinking it'll be more comfortable, but then they don't get any stretch at all. Others wear them with a correct ankle position or crank them too aggressively and they can't tolerate them at all. There's a sweet spot that takes some experimenting to find. Second mistake, expecting them to be a cure. This is huge. Night splints treat symptoms, not the root cause. They may help with that morning pain, but they're not fixing what caused your plantar fasciitis in the first place. Think of it like this. If you have a leaky roof, putting a bucket under the leak catches the water, but it doesn't fix the hole in the roof. So how do night splints fit into a smart treatment plan? Here's what they should be paired with. Stretching your calf muscles every day, especially calves, and I mean really stretching them, not a quick 10-second stretch. Wearing supportive footwear during the day, and activity modification to reduce the stress on your plantar fascia. But here's what they do not replace. Custom orthotics that reduce strain during the day when you're actually walking and putting weight on your foot. Professional treatments like shockwave therapy that stimulates healing of damaged tissue, and chronic cases, regenerative treatments where pain becomes chronic. Your body needs help repairing tissue that's been damaged for a long time. Night splints are one tool in the toolbox, not the entire toolbox. Now let me tell you about some better alternatives or add-ons to night splints. Daytime stretching and mobility work is often more effective than night splints. I'm talking about calf and plantar fascia stretching done consistently throughout the day. Custom orthotics work during the day when you're actually walking and putting weight on your feet. They reduce the stress on your plantar fascia with every step you take. In our office, we use shockwave therapy. It stimulates healing of damaged tissue instead of just managing symptoms. We're actually promoting tissue repair. For people who've had heel pain for months or years, we have regenerative options that can help when pain becomes chronic and your body is given up trying to fix the tissue on its own. So who should try a night splint and who should skip them? Good candidates are if you have new plantar fasciitis, we're talking weeks, not months. If you have severe morning pain that gets better once you start moving, and if you're willing to tolerate temporary discomfort to potentially get relief. Poor candidates are if you have chronic heel pain that lasts months, if you already have sleep issues and can't afford to have your sleep disrupted further, or if you have a low tolerance for bulky devices. Be realistic about what night splints can and cannot do. When should you see a podiatrist instead of trying to manage this yourself? Well, here are the signs that splints aren't enough. Pain lasting more than 6 to 8 weeks, pain during the day, and not just in the mornings, or pain affecting work and exercise. What a proper evaluation includes. First, we confirm the diagnosis. Heel pain isn't always plantar fasciitis. We need to rule out nerve pain or stress injury. Most importantly, we build a personalized plan on how long you've had the problem, what's causing it, your activity level, and what your goals are. The earlier you address these issues, the easier they are to treat. Don't wait until a simple problem becomes a complicated one. Here's my final takeaway about night splints. They can help, but they're not magic. The honest answer is that night splints work for some people, in some situations, when they're part of a bigger strategy. But if you're expecting them to cure your plantar fasciitis by themselves, you're probably going to be disappointed. The goal isn't just less morning pain, it's real healing and long-term relief. And that usually means addressing why you got plantar fasciitis in the first place and helping your body actually repair the damaged tissue. If your heel pain keeps coming back, get a professional evaluation. Don't rely on one tool alone when there are proven treatments that can actually help you heal. If you're dealing with persistent plantar fasciitis, especially if it's been going on for more than a couple of months, don't wait for it to get worse. Schedule an evaluation so we can figure out what's really causing your pain and get to that right treatment. The link to schedule an appointment is in the description below. And I've written an entire book about plantar fasciitis and heel pain that goes into much more detail about the treatment options. You can get it at www.heelpainbook.com. And I want to hear from you. Have you tried a night splint for your heel pain? Did it work for you? Or did you end up giving it up on it in a few nights? Leave a comment below and let me know about your experience. Your story might help someone else who's struggling with the same decision. Thanks so much for watching, and have a great day.